Melanie Chow, please come on in. Thank you. Hi, my name is Lizzie. I'm going to be your nurse today. Yeah, go ahead and take a seat. How are you today?
Good.
Good. I'm going to be doing your physical today. Do you know why you're here?
For an assessment.
For assessment. Can you mind telling me your full name and your birthday?
Melanie Chow, January 1st, 1987.
Excellent. And then can you tell me where we are today?
In the exam room.
In the exam room. Okay, excellent, thank you. And so when she walked in, I was able to assess her gait. I saw that she had a steady gait with no balance issues. Arms are swinging side to side. Okay, and also I can tell that she, now that she is alert and oriented ×3. What I want to do first is take her vital signs, okay?
Okay.
Okay, some alcohol on my hands. All right, can you stick your arm out? I'm just going to do your blood pressure and check your respirations and your pulse and your temperature. And we'll do height and weight. Okay, excellent. Thank you very much. And are you experiencing any pain today?
No.
Do you have any complaints at all? Shortness of breath, chest pain?
No.
None of that. Excellent. So going over her vital signs, which are stable. Blood pressure is 110/80. Heart rate is 65. Respiration 16. Afebrile, no pain. Also, her height is 5 feet and she's 100 pounds. She is a good BMI for her stated age. Also, I'm taking a look at her. She has good posture. She's sitting upright. She's interactive with me. Responses are appropriate. Her speech is also has no deficits, no slurring. She also can follow commands. I'm also looking and seeing that she has good hygiene and no odors coming from her. So I'm just going to ask you a couple more things. First, can you remember these 3 words? Dog, house, and car. Okay? And I will ask you about those later.
Okay.
Dog, house, and car.
Got it.
Got it. Okay. And next, I want you to identify some objects I'm going to put in your hands with your eyes closed. Okay?
Okay.
So close your eyes. Okay, put out your hand. And tell me what this is.
Pen.
Good. One more.
Rubber band.
Excellent. All right, able to tell what's in her hands. Next, what I want to do is I want to check your head. All right, put on some gloves.
I have some in the bathroom.
It's okay. And at any point of this physical, if you have any questions for me, you just let me know. If you have anything you need, any complaints about your health, you just let me know too.
Okay.
All right, excellent. At this point, can you go ahead and tell me those 3 words?
Dog, house, and car.
Excellent. So memory is intact as well. Mini mental exam was complete. All right, now I'm going to check your scalp. All right, long, black, beautiful, shiny hair. All right, of equal distribution. Feels nice and soft and very appropriate for her age. I'm very close to her, and I still don't smell any odors coming from her, and I can see that she is very well groomed. I'm taking a look at her skin. She has nice fair skin. No lesions, masses, abnormal growth seen. Can I see your hands, please? Flip them over. Thank you. I'm looking at her hands. She has good skin turgor, good hygiene, and also cap refill is less than 2 seconds on her fingers. Excuse me. Okay, next what we want to do is I'm going to check your face. Can you look at me? Can you smile for me? Perfect. Have your eyebrows go up. Perfect. Scrunch up your face and puff your cheeks for me. Okay. Cranial nerve 7 is intact. All facial expressions are symmetrical. And now what I want to do is I'm going to touch your face with this Q-tip. I'm going to use the sharp side. I'm going to practice on your hand right here. Sharp side and dull side. I'm going to have your eyes closed, and I'm going to touch your face, and you're going to have to tell me which one you feel.
Okay.
Is that okay with you?
Mm-hmm.
And this is checking cranial nerve 5. All right, here we go.
Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Sharp.
Good, thank you. Cranial nerve 5 is intact. And now I'm just going to take a look at your eyes. So her eyes are symmetrical on her face. Lids are symmetrical. No discharge coming from the eyes. Let's see. Sorry. And I'm looking at her conjunctiva and they're white. I'm going to touch her eyes a little bit. And her sclera are pink. Okay, and what I'm going to do is I need to darken the room. This is as dark as it's going to get. So I'm going to take a look at your pupils, okay? Just look at me, okay? And her pupils are of a light brown, so I am able to see, excuse me, her cornea? Her corneas are a light brown, so I can see the pupils, and they're equal, round, and reactive in accommodation to light. And also, one more test, I'm going to check the corneal light reflex. Just look at me still. And that is equal as well and intact, and that's cranial nerve 2 and 3. Next, what I want to do is I'm going to check your gazes. Can you just follow my light, okay? Mm-hmm. Perfect. Cardinal gazes are intact, and also they converge, and that's cranial nerves 3, 4, and 6, and there was no nystagmus as well. And now, what I want to do might be a little helpful. What I need to do is I need to check your blink reflex, and I'm going to use this clean Q-tip to poke your side of your eye and see how well your blink reflex is. And this is checking cranial nerve 5 in a second. So look forward. I'm just going to touch. Good. Good. Cranial nerve 5 and 7 are intact. Corneal reflex. Next, what I want to do is check your ears. Just move your hair back a little bit. So they're equal on her face. A lot of interesting piercings, and those seem to have healed well. Okay. No abnormal structures or growths on her ears. No discharge coming from them. And what I need to do now is I need to check your hearing. I'm going to use this tuning fork, and I'm going to put it on. I'm going to put it on your forehead. And you just let me know if you can hear the sound in one ear or both ears, okay? Here we go. Okay, that was the Weber test, and cranial nerve 8 is intact. Next, let's check your mouth. Can you open your mouth for me? Okay. Lips are pink, moist. Oral mucosa is pink and moist as well. Good hygiene, no odor. No caries. Can you stick your tongue out a little bit? Down so I can look at the kind of throat. Perfect. And tonsils are pink, non-swollen. And now if I could stick your tongue out, move it side to side. Good. And say the word ah. Ah. Good. Voice is strong. No slurring. Tongue is also strong. No atrophy. What I need to do next is I'm going to poke on your neck to check your trachea, okay?
Okay.
All right, here we go. Okay, and that is midline, trachea is midline, and I'm going to come back around and feel for your thyroid, okay? Thyroid is soft and smooth, and take a swallow. Good, swallow reflex is strong and symmetrical. And this is checking cranial nerve 9, 10, and 12, and those are also intact. Okay, just a second. Okay. Okay, next what can I have you clench your teeth? I want to check your muscles in your face. Clench your teeth, perfect. And so these are strong bilaterally. Cranial nerve 5 is intact. The next one I'm going to do is feel for your lymph nodes. So this is around your ears and your neck and back of your head. You doing okay?
Mm-hmm.
Move this a little bit, sorry. Okay, lymph nodes are soft and non-tender. Next I'm going to do is feel your pulse in your neck. 2 plus bilateral. And next what I need to do, can I have you look in that direction? I'm going to be pushing your face in that direction. Try to push your face in that direction. All right, here we go. Perfect. Let's do it on the opposite side. Perfect. And then if I shrug your shoulders and keep them up there and don't let me push them down. Excellent. And that was cranial nerve 11, and that one is intact as well. Next I want to assess your lungs and your heart is next. So I'm looking at her again, and she has good posture. It's upright. No increased work of breathing. No use of accessory muscles. No audible breath sounds heard. Let's see. I'm looking. AP diameter is also 2 to 1. Right. I'm going to take a listen to your lung sounds now. Just take a deep breath every time you feel the stethoscope, okay? Down here a little bit. Thank you. All right. If I can have you flip around so I can see your back. Thank you. Deep breath. Thank you very much. Just stay there for a second. Lungs are clear to auscultation by anterior and posteriorly. What I'm going to do here is I'm going to tap on your lower back a little bit. And this is checking if you have any pain in your kidneys, okay? All right, here we go. Any pain?
No.
Good. Any pain?
No.
Good. Excellent. You can turn around again. So rebound tenderness is negative. Next, we're going to take a look at your heart. So what I'm going to do is feel for your heartbeat first. Okay? So it's going to be kind of near your breast area, so don't be alarmed, okay?
Okay.
So, 5th intercostal space, mid-clavicular line. E.Ma is palpated. And I'm going to put my hand on your chest wall here. No thrills felt. Next, I'm going to take a listen, okay? So, 2nd intercostal space, right sternal border. It's going to be any aortic, adventitious sounds, which I don't hear. Now to the left sternal border for any pulmonic sounds. No adventitious sounds heard. I'm going to go 3rd, 4th, 5th intercostal space, left sternal border for any tricuspid adventitious sounds. And none are heard. And then moving to mid-clavicular for any any mitral sounds heard. None here as well. I'm going to feel for your neck again, the pulse, to identify S1. And there it is. Thank you very much. All right. Now I'm going to take a look at your stomach. Can I have you lie down with your head this way and your legs that way? And if you could pull your shirt up so I can see your stomach. Perfect. Move this a little bit that way. Okay. First I'm taking a look, and I see that it's flat. It's tan, consistent with the rest of her skin color. No jaundice, no distension, no lesions or masses seen either. Okay, first I'm going to take a listen here. Vowel sounds heard in all 4 quadrants. Next, what we're going to do is we are going to tap on your stomach a little bit. See if I hear any sound in there, okay? Any pain with that?
Nope.
No. Okay. Tiffany heard throughout with percussion. Can we get this back? Okay. Excuse me. All right, back online. Okay, next what we're going to do is light touch on your stomach. Let me know if you feel any pain with this, okay? How was that?
Good. No pain.
Okay, good. So no pain, no facial grimacing or guarding, and no abnormal lesions or masses felt with light palpation. So now I'm going to do it again with a little deeper touch, okay?
Okay.
All right, here we go. And how was that for you?
No pain.
Okay. Once again, no pain, no facial grimacing or guarding, and there was no abnormal lesions or masses palpated with deep touch. Next, what I'm going to do is feel for your liver. So what I'm going to do is support your back with my left hand. Thank you very much. And when I ask you to take a deep breath, I'm going to feel for your liver, okay? 1, 2, 3, go. And let it out. Okay, excellent, thank you. You can put your shirt down. So liver border is palpated and it is non-tender and soft. Next, what we're going to do is I'm going to check your wrists here. Thank you. Just your pulses. And there are 2+ bilateral. And if you go ahead and squeeze my hands as hard as you can. Good. Equal strength in the upper extremities. And I'm moving down to her legs, and I can see that the color is good. It's consistent with the rest of her body. No discoloration. No edema noted. And her toes and her legs have, appear to be well taken care of. Good hygiene here as well. And I'm going to go ahead and feel for those pedal pulses. And those are 2+ bilateral as well. And if you can push on my hands like a car pedal. Good. And those are strong. Those are strong as well, bilaterally. So our upper and lower extremities are strong bilaterally. All right. And also I'm going to take another look here. And, oh, there are your hands. And I don't see any swelling or abnormalities in her hand joints or her toe joints as well. Okay. Next, what I would need you to do, if I could have you stand up for me. What I need to do is check the curvature of your spine for any scoliosis. So if I could have you scrunch up your tank top as high as you can and then bend over for me. Good. I'm going to pull your shirt down up here, okay? And you have a straight curvature of the spine when you bend down. Okay, that's it. No scoliosis detected. And then if I could have you stand straight up, stand this direction and back up just a little bit. And stand with your hands out like this. And I want you to close your eyes and don't let me move your hands down, okay? So this is the pronator drift test. And this one is negative. All right. I just have a couple more things I need to do. If I could have you sit probably right there. And I need your legs to dangle, please. Let me see, okay, here. All right. I need to check your deep tendon reflexes, okay? So can I see your arm? Thank you. We're going to place it right here. See? And see this. Good. Here. Good. Okay. So that was the, just finish here first. Just relax. Good. One more time. Excellent. So 2+ deep tendon reflexes bilaterally and her radial reflexes and her brachioradialis reflexes are 2+ bilaterally. Next, I'm going to check the reflexes in your knees, your patellar. We can see it there. I'm going to scoot back just a little bit more. Is that okay? Yep. All right, here we go. Good. And the other side. Okay. 2+ bilaterally and patellar deep tendon reflex. Last thing we have to do might be a little ticklish. I need to stroke the bottom of your foot with this hammer to
Okay.
see what your reflexes are on your feet. Okay? Lift it up. One more time. Alright, good. One more. One more time. Okay, Babinski is negative. Okay, Melanie, let me just double check, make sure I have everything off of our list done. Alright, I think we're all good. Do you have any further questions for me?
Nope.
No? Okay, your physical went well. You're a very healthy young woman. You can put your clothes back on. Thank you.
Thank you.